Good afternoon. Thank you for tuning in today. My name is Jeff McKay with Brightsquid. With me, as usual, is Mark Ayer. We're going to go through the top tasks for Brightsquid Panel Messaging. So, panel messaging is a new feature we're very excited about, and happy to introduce you to that now. Today, we'll talk about communication in groups, what that looks like, why we would do that. We'll talk about what is Brightsquid Panel Messaging. We'll talk about how clinics use panel messaging to give you some ideas about what you can do to implement it for yourself and your clinic. We'll talk about the results that clinics achieve through using panel messaging or bulk messaging, and Mark's going to take us through a demonstration. We'll talk about communication in groups. So you can engage and manage your panel of patients. You can segment your panel of patients to talk to a specific group. This helps you strengthen relationships by being in more contact more regularly, more easily. So you can improve that continuity of care because you're top of mind, whether you're at a medical clinic or a dental clinic or a chiropractor. This allows you to stay in closer contact without requiring extra manual effort on behalf of your admin staff, who would have to reach out individually one at a time otherwise. We'll talk about some of the savings that clinics enjoy through doing things this way as well. Mark has some interesting stories about how people haven't saved by doing things in other ways. So we'll talk about some of that stuff too. And just really that efficiency of scale that we get through mass communication. And we'll talk about how it is functionally mass communication, but you're not actually communicating to the masses. It's more of a one-on-one experience for the recipient. So what exactly is panel messaging? We'll get a look at it soon. And Mark, please feel free to chime in with anything I miss, because you spend a lot more time working with clinics in this capacity than I do. And so it's really just a compliant way to send one message to as many patients as you need to receive it. So you can send it to, like I said, a segment of your patients. You can send it to all of them if it's an update about holiday hours, that sort of thing that's relevant. Messages appear personally addressed to the recipient, and it's integrated into your Brightsquid account. So you may have noticed a change to the interface. Up in the top left corner, there's that little menu with 9 dots in a square. If you click on there, that'll take you into your panel messaging account, and you can create and send messages through there. It is trackable to see what was sent, received, opened, and clicked, so you can understand how the engagement is working, what you might want to try to make it better if necessary, or at least kind of give you a sense about how impactful that communication was, something that you can't do if you're sending out something similar through the mail. You really don't know. It's a real send and forget at that point. With panel messaging, you do have one send per month included in your account. So you can send one message to up to 500 recipients. That's included in your subscription. If you want to send additional emails, it's $5 for 500. You can also use this service to send text messages or SMS, and that's $5 for 50. Unfortunately, text messaging is quite expensive to send, so this is basically just giving you access to that cost almost. How clinics use panel messaging, and Mark will take us through how this actually works. Notification is a big one. Change of service hours. We're closed on Fridays now, or this is what you can expect for us over the holidays. We've changed staff. Your old clinician is retiring, and there's a new one, and this will be your clinician now. New services we offer. So, hey, because you saw this, or based on your last X-ray, we saw that, and we have this new service that's applicable to you. You might want to come check it out. Something you can reach out to a whole bunch of patients. It could be 10, it could be 50, it could be 500 that you might want to notify people about to either get that recall happening, such as screening for different things. We do see a lot of clinics send out these campaigns for vaccination. So we noticed you're not vaccinated against COVID-19 and you're at risk for these reasons. So we really think you should, and here's some information about why. Or it's flu season, time to get your flu shot. We are now providing flu shots in the clinic. Call to book, or click here to book, or something like that. And the way that it shows up is that we can include information that's relevant to a patient history or a patient demographic or a patient condition, because they are accessing information in a secure way. So we'll send out the notification, and even if it's a text message, they click on a link within that text, that takes them to a secure page that they authenticate into. They verify their identity, and now they can get in there and see that information that may or may not be considered private. Something such as our hours are changing isn't necessarily private unless you are a psychiatry clinic or something else that's specific that would give indication as to this type of care that a patient is receiving. It's time for you to come in for a cleaning, or we'd like to see you for a checkup, or we haven't taken x-rays in a couple of years, so we should really get in there and see how your teeth are now. Or a lot of times, I know, Mark, you did this one a week or two ago, it's time for you to get a mammogram or some other diagnostic. Reminders is a big one. Hey, you could potentially send a notice out to everybody who has an appointment next week. You wouldn't be able to say exact time and date, but you'd say, just remember you got an appointment with us next week. Call us if you have any questions. Policies and procedures. So people who are coming in next week, if you just want to notify them of, now we require masks because of this, or now we don't require masks because of this, or before we told you you couldn't bring someone in with you and now you can. We've changed our address, or there's new parking procedures here, that kind of stuff as well. Contact us for. So this is another thing that clinics do a lot. Really almost a public service announcement. We help with these types of services. You can come see us for this. Don't go to the emergency room, for example. Come see us for this. Or go see your PCN clinic, or here's some more resources about how you can get care. And it really helps with treatment adherence because we can supply instructions, follow-up instructions on either meetings about a diagnosis or really just follow up. And that's where the information comes in. You know, we talked about you should really get vaccinated against COVID-19 because of this, or now that you're pregnant, here's some information you need to know about these risks or these other things, that sort of stuff. And the self-management support is really big. So you have a panel of diabetic patients and you want to send out information about how to make sure that you're staying healthy. And you could do that on a regular basis, every 3 months or every 6 months or something like that. Clinics are doing that. And then seasonal care, hey, it's flu season. Here's how to look after your kids when they're not feeling well, or watch out for these symptoms that might mean this, that kind of thing. And the results of panel messaging go. So cost savings is huge. We did have a clinic that was about to do it, and someone at the clinic said, we're just going to mail these out. What could go wrong? And they called us a couple of weeks later and said, yeah, that cost us $3,000 to send out. Mark, I'm not sure if you remember, it was a few hundred. It was not more than 1,000.
Yeah, that's right. I mean, we often don't think about the money that we're already spending on services that we're used to. And so this particular clinic, and of course I won't name names, was using secure mail. I talked to one of their MOAs about sending them out a bulk message because they had a doctor that was retiring and they wanted to give their patients a heads up, let them know how they could find a new doctor and so on. And it would have been trivial to send it through Brightsquid Secure Mail. Would have been less than a couple of dollars, maybe 20 in total. But the MOA that I was working with was overruled by the doctor who thought that Canada Post was a better way to do this. So they did. And like Jeff said, a few weeks later, they called me back and said, yeah, we should have done it through Secure Mail because it cost us over $3,000 to send roughly 1,000 messages out to our patients through mail, because a stamp costs $1.10 these days. I think with bulk stamps, you can get them down to 95 cents. Now, a piece of paper and an envelope doesn't cost that much, but it adds up. Not to mention ink for your printer. Not to mention some staff member has to lick the stamps and stuff the envelopes. All that adds up. Whereas with Secure Mail, like I said, or Jeff mentioned, the price is about a penny per on average when you're sending out the messages. Not only that, with Secure Mail, and I'll talk about this more in the demo, we can actually show you a read report to determine how many and who read the message and who we couldn't reach.
Yeah, it really is about efficiency. You know, it's that sort of one-to-many communication helps staff be more effective. We're not, you know, if you've got a list of phone calls to make, we're not going through a list, calling people, scratching them off, knowing that they're probably not going to answer the phone anyway. That's typically the expectation these days. That's what we hear from clinics, is most of the calls are not answered. We can't really leave an effective voicemail, so we have to hope they call back during a time when we can answer the phone, and it gets difficult to manage. With this, they can still reply if need be, and have a conversation that way around people's schedule as that allows. We're not fixing everybody to requiring that one-to-one interaction at the same time. We've seen clinics say things like, this would have taken us months or years to do this. We help the clinic send out a notice encouraging a certain segment of their patients to enter a treatment program around a certain vaccination, and they were able to get a couple hundred patients in and treated that needed the treatment, that otherwise it wouldn't have happened unless over the course of many years, as they had different interactions. They don't have time for staff to be calling all the time. And also that relationship, right? I think if any of us have fallen into an email cycle with TELUS Health, for example, TELUS Care, other places like Sun Life, Lumino Health, all these different ones, I get regular emails from all of them saying, hey, Jeff, how are you feeling? It's January. Many people are feeling this, and here's how you could address that. We're just here to help. That coming from your clinic helps with attachment, engagement, and really strengthens that relationship. So that kind of brings us to the end of my portion. And Mark, you get a whole 18 minutes to take us through all of this kind of stuff.
Okay, perfect. So to start with, before I do anything, a little word on terminology. So we're calling this panel messaging. The idea being that you can send a message to a panel of patients and it can be customized to a certain extent. Now, we might call this bulk messaging, we might call it mail merge. These are terms that are used by other applications similar to this service. What really sets the Brightsquid panel messaging component apart is because of our pedigree and our history with secure messaging, you have the option to send the bulk message in a secure mail format so that healthcare concerns can be addressed directly and the patient can reply just like they would to a regular secure mail message, and that reply would in turn also be secure and compliant. And that'll make a little bit more sense here when I start showing you some of the bells and whistles that I'm excited to show everyone today. So to start with, here I am in my regular secure mail homepage. Now, a couple of months ago, we talked about our templates feature. Now, templates, as you may recall, allow me to save myself keystrokes by automatically deploying a particular message that I send time and time again. So in this example here, I selected my patient invite template, which of course everyone can customize to whatever degree they'd like to for their own particular organization. But when I send this template, this one here is to invite a patient to join Secure Mail, I can address it to a couple of people up here, just like I would by typing in their information, which is fantastic and saves me a ton of time if I'm sending the message to 1, 2, or 3 people. Each time I have to add another person, I'm going to put in their name here, which is great. However, what if I want to do this for 10 or 100 or 1,000? Well, that's where the panel messaging allows me to import a list of patients and merge that to a message that I'm going to be sending out. So that brings me to this little checkerboard icon. Jeff called it the 9 squares up here in the top left-hand corner of my screen. You may not have seen this, it's relatively new, but this opens up access to the other applications that you have access to or you may want to learn more about. We're going to be talking about panel messaging today, but of course we also have appointment reminders. We have some care plan management stuff that'll be launching very, very soon. So keep an eye on this section. There's often new features being added to your account all the time. So when I go into panel messaging, which I'll do now, we're going to see a whole new Brightsquid interface. So we're still going to be sending messages, but now we're doing on a much, much larger scale. And the long and the short of it is we have a list of patients and we have a message that we want to send to those patients. So we're going to merge those two together. So I have here a couple of examples of different lists of patients that I've previously uploaded. So I've got all my female patients, I've got all my patients. This is just a sample list. And then new patients added in December of 2022. And this one's really cool. And I'll come back to that in just a moment. The other section are my campaigns. And by any other name, these are just the messages that I'm going to be sending out to those patients we just saw on the other screen. And here again, I have a couple of different examples. I've got my patient invite. So welcome to our clinic. Here's how you sign up for Secure Mail and here's how it'll work. Mammogram consultations, encouraging patients to have a specific procedure or discuss a specific condition with their physician next time they're in the office. And another interesting one is this HPV campaign, which you've probably heard us talking about before, which is encouraging patients to consider their HPV risk, and when and where it's appropriate, they can discuss it with their doctor, their physician, their healthcare provider, and have that immunization um, procedure completed. Now, I clicked into this one by mistake, to be honest with you, but this is perfect. It gives me a good time to talk about how these campaigns actually work. So the titles aren't that important. There are potentially up to 3 messages in a panel message. Now, the first one is the email notification. This is a plain old non-secure email that will go to our recipient's plain old email inbox. This is a great place to send public service announcements, like we're going to be closed for Christmas. Not a good place to send something about HPV, for example, and I'll get to that in just a moment. Now, this message I've made very, very simple, where it says, dear first name, and that'll be the patient's name filled in automatically. Just a quick moment on that. Your physician, attending MD, has an important message about your health. Click below for details. For all intents and purposes, the patient experience on this is going to be identical to every other secure mail message they've ever gotten, in that it's a notification to log into their account. Now, when it comes to these little dollar signs and brackets where we've got these placeholders, here's where we can fill in information automatically. Here's where the merging happens, so to speak. So I can select their first name, their last name, their birth date, their PHN, their gender, or in this case, their attending physician or attending MD as it's called here. Now that's for the email. Jeff mentioned we can also send these messages as an SMS message. So here is what the SMS message would look like. Pretty much the same. The only caveat to SMS, as Jeff mentioned, there is a different price point on that. And SMS has to be really short. You can only send messages in SMS or a text message up to 300 characters. So if you have a longer email, you would need to truncate that a little bit to make it fit into SMS. Now, in either case, if we include the secure message, which I've done here, there's a little slider that allows me to turn on or off the secure content. So if this is turned on, as it is here, this is where the patient will now log into their Brightsquid account or register their Brightsquid account if it's their first time. They'll get that same invitation process that your patients are used to. And then they'll be able to read the actual secure message from their physician. So in this case, I won't read it all, but this is important. Mark, ABC Clinic, and Dr. Bob are committed to your long-term health, et cetera, et cetera. And then there's a whole message here and some links to some external sites to talk to patients about their HPV risk. And ultimately, we want them to make an appointment with their physician to come in and discuss, should I or shouldn't I follow through on this vaccination course. I've also included a self-screening form as an attachment. So just like with regular secure mail, boy, I've said that a lot today, we can include attachments that the patient can then download, in this case, fill it in and send it back to the doctor's office. Okay, so if I go back to my campaign list, we'll look at one more. Patient invite. This is the other one that I wanted to talk about. Now, you can make up as many of these as you want. You can have as many lists of patients as you want, and you can deploy them multiple times. So in my patient invite example, I won't go through this in quite as much detail. The actual email message that the patient receives is a little bit more robust because it's explaining to the patient what secure mail is and how it's going to be used for the patient to communicate with their providers. Further down, there's also the truncated version in the SMS. Oops, I haven't written that part yet. I'd have to make that up. That's fine, no problem. And then ultimately, once they log in to their secure mail account, there's a little follow-up message, congratulations, you signed up for secure mail. I sent you some documents, parking information for our office, and I sent you a little intake form that, oh my goodness, I would love for you to fill this in before you come in to see us so that we have all of your medical history. And all this will come back to your clinic as a PDF. You put it into the EMR, and the doctor has more information before they see this patient for the first time. Again, all of this can be customized to whatever level of customization feels appropriate for your clinic. Now, let's go back to the campaign page. You'll notice that I've done a little bit of testing here. So in addition to the ones that I haven't sent yet, there's a couple down here that have been sent. I did a test HPV campaign a few weeks ago. Oops, I clicked it by accident. And what I wanted to show you was this dashboard. Now, I talked about this a few minutes ago when I was talking about that $3,000 bill someone got for sending Canada Post letters to 1,000 patients. The downside to that is, of course, we don't know if Canada Post actually delivers the stuff. I'm not disparaging the post office, but that's just not the way mail works. We only assume it gets through. We really don't know for sure. With these panel messages, we get a read receipt that shows exactly how many messages were sent, how many were delivered, and where available, whether or not they opened and read the secure content. So in this example, we didn't count notifications and there was no secure content. So the bottom line is we sent it to 3 people, 2 were delivered, and I can see right here, oh, look at that. Jeff, we couldn't deliver the message to, probably because there was a typo in his email. But it's a simple matter now for me to give Jeff a call, double check his email, and I can resend this message to him in a matter of minutes. I would never be able to do that with a Canada Post or any other messaging service that I'm familiar with. So how does this all work to put it all together? Well, let's very quickly, I'm just looking at the clock, very quickly I'm going to make up a new patient list and I'm going to make up a new campaign. So let's go back to patient lists and I'm going to create a new list and I'm going to upload a file. Now the files that I upload, the files that we use for lists are going to be a CSV. So a CSV, which stands for comma separated value, is essentially a spreadsheet that has a list of all your patient information, their first name, their last name, their email address, their date of birth, etc. So I'm going to select the sample copy, and I'm just going to call this, demo version, and I'm not going to describe it any more than that, demo version, and we'll upload this list of patients. Click save, up it goes, and here is my new list of patients in demo version. And here I can see, these are all pretend made up patients, obviously. And here we can see the 17 patients that I've just created the new list for. Now, a couple of filters at the top I want to point out is we actually have a valid and invalid filter. Now, invalid doesn't refer to the patient, it refers to the contact information. So if an email address is invalid, we'll highlight it here in red. If the patient has an email address and or an SMS phone number, they'd both be shown, but if either is invalid, they would be highlighted. Things like that allow you to scrub your list really quickly and make sure that when you click send, it's actually going to go to all 17 at the same time. All right, so this all looks good. I've got no invalids, so that's perfect. Let's move on to making a new campaign and click campaign. We'll create a new campaign. And just in the interest of time, I'm not going to be creative. We're going to call this test, describe it as test. We're going to say the email subject line is welcome to the clinic because my autocomplete has that there for me. And I'm not going to type anything too clever in here. I'm just going to type in and I'll grab a couple of placeholders just to show how that all works. I'll do the same thing. I'll just copy and paste the same nonsense into the SMS content. And I'm going to leave off secure content because there's no need for the secure login. They don't need to verify their identity just to read this short message that I'm sending them. And then we're going to select which list of patients we're sending it to. So you remember from this patient list that I looked at a moment ago, I have about 5 different lists of patients here, and I want the demo version, which has 17 people in it. We'll select that. We click save. And then in our test version, we open it up and we click launch. Takes a moment to format. And when all is said and done, I get a quick review. I'm sending to 17. 17 are targeted. Patients are all good. Doesn't cost me anything because it's under 500, and off we go. That's how that works. It's just that easy. Whether it's 17 or 1700, it takes about the same amount of time to send out this bulk message. So I could send out my patient invite every month to all the new patients that I've invited in the last couple of days or months or whatever that have joined my clinic. So here's all my new patients from December 2022. We save that, we send that, and all of those patients get onboarded to Secure Mail. They'd automatically be signed up and be ready to go. Now I'm just looking at the clock on the wall and I see that we also have some questions coming in. So I just want to show one quick thing before we go. I took one of my actual campaigns and screenshotted it earlier here. So I'm just going to share this. I've obscured some obvious information here, but this was a campaign that we did for a Calgary healthcare clinic about a month or so ago. And they had 55 patients that they wanted to reach out to encourage those patients to come in for a specific consultation. Now, of those 55, as you can see, we were able to deliver 54 of the messages. One had a bad email address, no big deal. We didn't count notifications, but what we did count, the important part over here, is that of the 54 patients who got the message, 36 of them opened the secure content at the time this screenshot was taken. Now, more of them may have opened it later on, but that's nearly an 80% uptake on messages delivered through this format. Now, the message came from their doctor's office, who they were familiar with. It came from their doctor, who they know and trust. And it came through Brightsquid, which is a service that some of them, most of them, were already familiar with. So this is a very high open rate. Jeff will tell you in marketing, you can be happy to get 10% on an average marketing campaign. To get 80% on this kind of a bulk message to patients on something as so critical as managing their health is extremely powerful. Jeff, I see some questions came in and we're running out of time here. Do you want to, what do you want to do?
Yeah, that's great. Let's address some of these. I think we did get to Sherry's question about can you choose patients? Do you want to just address how those lists can be segmented in a little more detail?
Yeah, it's going to vary depending on which EMR you're using, but you can export a list of patients. Let's say, for example, I want all of my men over 50 to come in for a certain procedure. I can go into my EMR and I can do a filter based on that, but then I can also manually scrub that list. So if I get 100 patients, I can remove, the patients who maybe are outside of the age bracket that I was really looking for, or have other concerns. We can customize that spreadsheet. It's not hard coded in any way. And then you just upload those specific patients that you're interested in. It all starts at your EMR. Every EMR is a little bit different, but once you've got that list of patients on your computer, you can slice and dice it in Excel or whatever spreadsheet software you prefer. And then you upload it once you've got the list that you want. And then you just name that list, men over 50 that live in Northwest Calgary, or whatever is appropriate in your example. And then you would just send the right campaign to those people.
The other thing to mention is that sometimes if you're running a screening campaign through here, you might not want to have a couple hundred responses at once. So with a list that might be a couple hundred long, or even if it's 100 and you want to do 20 a week or something like that, clinics have done that too, just to break it up so that you're still able to address everybody, but you're not overwhelming the clinic with an influx of requests or calls or appointments. The other question is, do we have to include an SMS message, or
Oh
can it
no, not
strictly be an email?
not at all. I was so busy showing all the cool stuff that I forgot to mention. You can just upload a list with only email addresses. So if you don't have phone numbers or you don't want to use SMS because of the fees, you can absolutely just send them through email, or vice versa if that's your preference. We have some clinics who have more text message numbers than they do emails, and yeah, that's all up to you.
Great. And then we'll just do two more quick questions here. I think one is, what about forms? So we talked about attachments and having people fill those out. Are there forms? Will there be forms?
You can certainly send the form in the example that I showed, which is as a PDF, the patient would fill in and send back. I don't know if what you brought it up, Jeff. We are working on fillable forms that patients will be able to fill in without having to download a PDF. I'm not going to go so far as to give you a timeline, but it is certainly something we're working on for this year, whereby patients won't have to download a PDF. They can just clickety click on a form built into the message that they receive, and we'll be sure to let you know when that's available.
Absolutely. And then how is this built? Can you just talk about, I've got a subscription, and then what?
Yeah. So with a subscription to Secure Mail, it includes an outbound message to up to 500 email recipients every month. It's resets, I think, on the first of every month, and so you can send a small campaign out or not small, a pretty good size campaign out once a month at no additional charge. If you do 2 campaigns, the second campaign will start costing you $5. Am I saying this right, Jeff? Is it $5 per 500 recipients?
Yeah.
Yeah, that's right.
Yes.
Or if your initial campaign is over 500, then we bill the same way. So basically $5 per 500 recipients, or a cent or 1 penny per email recipient. It gets a little more complicated with SMS in that it's $5 per 50 recipients. But if you're not using SMS, then don't worry about that. If you are using SMS, it's still a great way to reach your patients, but you may want to consider getting emails if you want to save yourselves a few dollars. But honestly, even to send to an SMS message to 100 patients is only going to cost you $10.
Yeah, not bad. One last question just to squeeze in. Can we reuse lists once it's uploaded?
Yep. Yeah, you can reuse the same lists over and over again. So if you have a list, say, of all your patients, and you want to send them a holiday announcement, and then send the same Valentine's Day announcement to them in February, and then some other announcement, I don't know, in the springtime, then just use the same list each time. That's fine and dandy. You may want to update it as you add more people to that, which you could also do, but I didn't have a chance to show it today. But the answer is yes, yes, and also yes.
Okay, and that's once it's uploaded, it's there for reuse. We don't have to upload it again.
That's right. Yeah.
Yeah. Perfect. Great. Well, awesome. Thanks so much, Mark, for the in-depth demonstration, and thanks everybody for tuning in today. If there's any other questions, please feel free to reach out to support. There are also several articles on the support portal all about panel messaging and how to use it, how to create lists, how to get them in there, and that sort of thing. So thanks again, and have a great rest of your week.
Thanks, everybody. Bye-bye.